This is your spring presentation for health awareness education. I am yours truly, Lucy Umphreys from Main Street Church of God in Christ, where Pastor B. Clay is our pastor. Today is April 13, 2023. Okay, let us get started. So, spring is in the air. Of course, we know that spring marks the beginning of our warm weather and the end of winter. This is a time that's very significant because we're getting out, we're walking, we're exercising, we're riding bikes, we're planting, we're grooming our yards. So we're outside a lot more. So this is just some information to help you to be aware of some of the common illnesses that are associated with springtime so that you can take measures to avoid those things and try to keep yourself more and more optimal health. So some of the woes of the beauty and the blooming of spring. Of course, you're gonna need your Kleenexes handy if you have any of these things. With these beautiful flowers that are blooming come a lot of woes for some people, not for all, but for a lot of people. What are some of these common spring illnesses? Seasonal allergies, asthma, conjunctivitis, which most people are associated with that word as being pink eye, Lyme disease, and your respiratory viruses. The common cold is one of them. You have COVID, you have influenza or flu, and then you have RSV. So some of the seasonal allergies, I'm going to give you the symptoms and the main areas of the body that it usually affects. So you have sneezing, which is going to affect your nose. Congestion affects your throat. Runny nose affects your sinuses. And then your itchy and watery eyes, of course, are going to affect your eyes. So if you are stuffed up with sneezing this time of year, then if you're one of those hay fever or allergy sufferers, you're not alone. There's about 50 million people in America that suffers from that, from seasonal allergies. And these are coming from your trees and grass pollination, as well as mold from the rainy season. And we have certainly had a lot of rain this year. So these are usually your biggest culprits for your congestion and other allergy symptoms. Windy weather, of course, affects it also, because what that is going to do is going to blow the pollen all over the place. So this time of year, I am one of those sufferers. So I make sure that I keep a mask. I know COVID season is over, but allergy season with the itchy, watery eyes, it may affect the skin and make your skin itchy. And all of that coughing and runny nose, I'd rather wear a mask. So that's one of the things you can do. And since we know we can't avoid breathing in the air, that's why I choose to wear a mask, because it will also help to keep some of those allergens from entering into my respiratory system. So in order to leave them outside, you want to make sure that after you've done yard work, exercise, or walk outside, even when you touch your car doors, because we see the yellow pollen all over our vehicles, you want to try some of the over-counter stuff. If yours is not really bad, they are called the OTC. And if they're really bad, you have your prescription medications that will give you relief. And be sure to discuss these things with your physician. I am not a physician. I'm just someone that I want to give you some awareness about the things that are going on and the effects that they have on your body. So let's talk about now your specific triggers, symptoms, and ways you can find relief. So some of your over-the-counter allergy medications can be Allegra, Zysol, Benadryl, Claritin. There are a plethora of them. And then you also have your generic brands, which I've used before myself, and they work, a lot of them work just as well. These are just to show you that I have a picture on here that they come in liquid, they come in capsules, but they also come in chewable tablets for the children. The chewable tablets and the liquids I find are best for your smaller children. And be sure that you don't have that your child doesn't have an allergy to any of these, because sometimes they can't tolerate those. So I would get that diagnosis from a physician for sure. Asthma. So you're saying the same springtime allergy triggers, your pollens, your molds, they're going to do the same thing to your lungs as your seasonal allergies can do, but it's much worse when you have asthma. So what the body does in the immune response is that once you breathe these allergens into your nostrils and it goes throughout your lungs, then your lungs are going to perceive this as a threat, because your body is going to say, this doesn't belong here in my lungs. So then the person starts to experience coughing, especially in the early morning, and at night they begin to have tightness in their chest and wheezing and shortness of breath. And sometimes they can also suffer from nasal drip or stuffiness in their nose. If you have asthma, you should have already had a diagnosis from that from your pediatrician. If your child has it or you have it, you should have something that looks like this, what we call them your metered dose inhalers. So these are just different types of inhalers. Some of them are quick acting or fast acting, where you can take those inhalers when you're in an active asthma attack and it'll work real fast. And some of them are those that have your steroid that you take twice a day to maintain that asthma. But for this, you will need a physician, you will need a diagnosis, and he will put you on the right medications for that child or for yourself. Respiratory viruses. So I said the cold, COVID, flu, and RSV. Of course, we know there is no cure for the common cold, and it can be really, really, really nasty sometimes. But for COVID, there are vaccines available. There are boosters also available for the COVID, especially if you have underlying conditions like heart disease, diabetes, high blood pressure. You want to be sure that you get those doses of those immunizations. You also have RSV, which is respiratory syncytial virus, which wreaked havoc on the state of Arkansas last year. So many of our babies had the virus. I think it was really in all of the United States, because they started to run low on some of the medications that they were using for it. There is no cure or vaccine for RSV. What you want to do is be careful with your newborns, with your babies. You don't want anybody kissing on them. And you don't, because this is usually comes from the nasal passages. So you don't want them transmitting that to your baby. So the only thing they have for that now in the medical world is very limited. They just can offer supportive care, such as the oxygen and the fluids for those when they do get ill. Classification of certain viruses or bacteria. Now we have airborne viruses, which is direct contact to the diseases like your chickenpox, COVID-19, influenza or the flu, meningitis, and measles. These are things that when it's released into the air, you inhale it, and it's just in the air. Then you have your bacterial viruses, which are your Clostridium, E. coli, Listeria, norovirus, which is one of the new ones. I will be coming to you all later with some information on this norovirus. It's an intestinal virus, and it is horrible. Salmonella is also another one. And then your Campylobacter. That's one that these type of bacterial infections are the ones that might land you in the hospital, because they're so, they once you get these, they don't just work their way through the system, and then it depends on your immune system and how strong you are on whether or not you will need to be hospitalized. Usually you will with a bacterial infection. So how does a bacteria virus spread? They're transmitted to humans through air, water, food, or living vectors. The principal modes of transmission of bacterial infection are contact, airborne, droplet. And when I say vectors, I mean these are blood-feeding arthropods such as your mosquitoes, your ticks, and your fleas. And they are vehicular mode of transmission. It's just like a car. Say the tick or the flea or the mosquito is a car, and once it bites you, that vehicle transmitted whatever bacteria was in them. That's how that is transmitted. Then I have a managing mild COVID-19 symptoms. This is through CDC. When we had COVID going widespread, and it's going to be the same thing for any virus. Strict hand hygiene, water and soap and water is going to be your best. But if you're not around soap and water, continue to use your hand sanitizer. Use a mask if it's airborne. And you want to keep your surfaces clean still with your alcohol, your bleach, wear your gloves if you need it. And if you need isolation, then isolate. So this is just a picture of the things we've just talked about. That you have your mask, you have your gloves, you have your hand sanitizer and your mask again. And these are just disinfectants that you can use for the air. You know, you can use your Lysol to spray the areas. Insect bites, stings, and first aid. Most insect bites and stings are mild and they can be treated at home. They may cause itching, swellness, irritability, but more than likely they can be treated at home, and usually they go away in a day or two. This is going to include your spider bites as well. Some bites can transmit disease causing bacteria. And once again, here's that word, bacteria. Whenever you hear that, that's usually significant because it's going to be it's not going to be just a mild reaction. They can transmit disease-causing bacteria, viruses, or parasites like your worms and stuff. They look like worms, but they're parasites. They're smaller. Sting from bees, yellow jackets, wasps, hornets, and fire ants may also cause a severe allergic reaction that we call anaphylactic reaction or anaphylaxis. So if you get bit by a spider, any of these things, and you have a reaction, what you want to do is use ice packs. Ice packs is going to cool down the sting itself, is going to reduce the swelling, and it's going to make the child or the person feel a lot better much faster. So this is just some of the things, because everything is so high now. I've found some remedies for your homemade ice packs. Rubbing alcohol and water is very good, because the water is going to keep it from freezing completely, which makes it an easy way to create your ice packs. So what I found that I do, if you use your 1.5 cup of water to 1.5 cup of rubbing alcohol, even your colored wintergreen alcohol, rubbing alcohol is good, because they'll just give it a nice color to it. And this mixture, if you put it in your snack bags, put some in your snack bags for the smaller bites. And then if it's a larger area, you can use the sandwich bags. So you can half it up, half and half. Another one I found was your corn syrup ice packs. You can use those. Taro syrup is just a brand, but it's your light corn syrup. That's all it is. And you can put that corn syrup in there, and it's going to make it a lot flexible and give it that gelatinous substance that you need, just like a good ice pack, and it'll stay frozen really good when you put it on those bites. I do want to alert you to not put the ice pack itself directly on the bite. Put a washcloth or something in between there, because children's skins and elderly people's skin is easy to burn, and they can get a burn from that ice pack as well as a burn from a hot pack. So be very cautious of that. Okay, so on your review for your anaphylaxis, that's a severe, potentially life-threatening allergic reaction that can happen within seconds, or it could last for much longer. So that's something that a person gets when they're exposed to something that they're allergic to, such as peanuts or bee stings. It requires an injection. It requires a medical diagnosis. It requires a physician to diagnose you with this. And the medications that you take is always followed up by a visit to the emergency room or the emergency department. If you don't have epinephrine, you need to go to the emergency room immediately if that occurs. So some of the symptoms that occur actually occur a half hour or longer later. So that's why you want to take them to the emergency room to make sure the allergen is completely out of their system. Some of the skin reactions can be hives, itching, and flushed or pale skin. Their blood pressure is going to drop and be low. And then the main thing that we're looking for is those constriction of the airways and a swollen tongue or throat, which can cause wheezing and trouble breathing. They're going to have a weak, rapid pulse. They can have nausea, vomiting, or diarrhea, and dizziness and fainting. And over to the side are just pictures of some of the prescription drugs that you get for that, for your EpiPens, is what we call them. Even though it's epinephrine, we call them the EpiPens. And you're going to see the doctor if you or your child or someone else with this severe allergic reaction. You don't want to wait. You want to, if the symptoms don't hurry up, go away, you want to go ahead and get emergency help. You might have to dial 911 because it really acts fast. Make an appointment to see your physician or your healthcare provider, because usually after you inject yourself with or someone injects you with epinephrine, you go to the emergency room and they're going to make sure that you have a follow-up appointment with your physician before you leave. So prevention, of course, is the best way to maintain it or manage anything. But the best way to prevent anaphylaxis is going to be to stay away from the substances that causes the reaction, wear medical alert, bracelet or necklace if you have a severe allergic reaction to the substance. You're going to wear long sleeve shirts and pants. Don't walk barefoot in the grass. Don't wear bright colors or perfumes, because these things, if you're allergic to bees and wasps, are going to attract the insects to you. Don't wear scented colognes, lotions, scented. Stay calm when you're near a stinging insect and move away slowly. Never slap the insect up, because if you hit it, its first response is going to be to protect itself, so it will sting you real good. If you have food allergies, you want to be careful to read the labels of all foods that you buy and eat. The manufacturing processes can change, so it's important to periodically recheck the labels of foods that even you commonly eat all the time, because I've learned that nuts are used in a lot more products now. So if you have a nut allergy or something like that, you want to be sure that you read all your labels, because they're present in foods that you really wouldn't think they were in. This is a picture of an actual prescription. It is called EpiPen, and they usually come in packs of 2. You will have to have a prescription for this. Your doctor will know the dosage you need based on your weight or your child's weight, and this is what it looks like. Lyme disease. Now, there's about 30,000 Lyme disease infections each year. These are caused by what they call the black-legged tick or the deer tick, and they live in areas, wooded areas where trees are, when you're in the park and fishing, when you're outdoors in the wilderness usually. Symptoms could be minor, causing just a headache and fatigue. It causes what we call a bullseye rash. I'm going to show you that here shortly. Or it could be more seriously and affect your entire nervous system. And at that time, you will need to be treated at the hospital. Take precaution, especially when you're in grassy or woodsy areas. The Northwest from Virginia to Maine, these are the regions that are woodsy, and they are usually found in the north central states with Wisconsin and Minnesota. On the West Coast and Northern California, relatively few cases are found in the South, but they are occasionally found. I included this information because it's summertime, it's springtime, and we travel and we take vacations. So if you're in those areas where you go and take a vacation, you can still get bitten by one of these ticks. You're fishing, you're out having family reunions, you're at the park, so you can still potentially get these bites. So this is just informative information for you to know. That means wearing long pants, long sleeve shirts, and hat, as well as insect repellent while you're outside. Stay groomed in your open areas. Check your body and your clothing for ticks. So when you shower, you're going to look, especially after you come outside from in the woods, fishing and at the parks and stuff, and check your skin for ticks. And if you do find one, you want to take a pair of tweezers, pull it off, wash that area, take that tick and put it in a plastic bag so you can show the physicians if they make you sick, you can show them what type of tick actually bit you. This is a picture of the deer tick or the black-legged tick. This is a dime. You know how small a dime is. So it's just showing you that the adult female is the largest tick, and they're the ones that usually bite you the most and just suck your blood. So this is what it looks like. It has the black legs. And if you're bitten by one of those and begin to get sick, have the severe headaches and things, you want to get to either the emergency room or to your physician to make sure that it wasn't one of those that bit you. This is a tick bite. Remember I told you about the bullseye bite? So we call it that because the bite is here in the center, and then around it is a perfect circle, and the bullseye is here where the tick actually bit. So this is what it looks like when you get bit by a tick. It has this bullseye rash. And that is the end of my presentation. I do thank you. And I pray that this is an informative message for you. As you get outside, by all means, enjoy the outdoors. It's beautiful. The sun is shining, but just be cautious and be aware. And these things will be posted so that you can go over and look at them whenever you so desire. I thank you. If you have any other questions, I did want to add CDC. You can always go to CDC's website when you're unsure of something. I think it's cdc.gov or cdc.org, one of the two. And you can find this, I think it's .gov, and you can find all that information there. Thank you and have a blessed, wonderful rest of your day.